Diabetes mellitus. Types of diabetes.
Diabetes is a disease in which glucose, or sugar levels, are above normal in the blood. Most of the food we eat is turned into glucose that our bodies use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin that helps glucose get into the cells of our bodies. When you have diabetes, your body doesn't make enough insulin, or it can't use its own insulin as well as it should. This causes glucose to build up in your blood. There are several types of diabetes. In type 1 diabetes, the body does not make insulin. In type 2 diabetes, the body does not use insulin well and may not make enough insulin. This is the most common form of diabetes. Gestational diabetes happens when a woman's body does not use insulin well while she is pregnant. It raises her risk for type 2 diabetes and raises her child's risk of getting diabetes.
Symptoms of diabetes.
The three classic signs of high blood sugar, we call them the 3 Ps, polyphagia, polydipsia, and polyuria. Those are increased thirst, increased hunger, and increased urination.
It's easy to minimize increased thirst, especially when it's hot, and frequent urination seems to naturally flow. But experts say it could be our body's way of flushing extra glucose.
The kidney has to work really hard to get that blood sugar out, that blood glucose out when it's high.
Wounds that don't heal could be another warning sign.
The body's not able to fight that infection because of that extra glucose in the system.
Frequent yeast or urinary tract infections may also be a red flag many people fail to consider. The earlier diabetes is picked up, the easier it is to avoid complication.
Risk factors for diabetes.
Again, as I said, it's a genetic disease, so there has to be some predisposition along the way. And a child or a teen, and unfortunately we see a lot of type 2s in the younger individuals, and being overweight and sedentary, those two things combined is the tipping point. That instead of a person waiting till age 60 to get diabetes, that kid at 14 who's overweight and just plays video games could be the age that the diabetes may actually occur.
Prevention of diabetes.
Diabetes is about calories. It's a storage of extra calories in the form of sugar. If you know that you have diabetes for a young age or from a certain age where you did not think it will come to you, it is actually calling for you to just measure your calories and have a lifestyle which supports those storage phenomena. First, eat your food on time. Second, eat limited quantity of food. It's not about stopping rice and sugar and binging on all the other things. It is about taking that limited calorie diet so that you do not have enough calories to be stored later. And most important, which I have seen really works beautifully, is consume the calories which are stored, literally translation, exercise. If you're able to burn away the extra calories, if you do not have any stores of calories, God forbid for all your great-grandfathers to have gifted you diabetes, you will not develop it. But stress over it, eat nothing, you will still have diabetes. Please stay away from stress, lead a sensible life, lead an active life, and be diabetes free.